Hello everyone, welcome to the YouTube channel. Today we will be discussing about pleomorphic adenoma. Pleomorphic adenoma is one of the most commonly asked 10-mark questions. Asked the definition, etiology, histopathogenesis, prognosis and treatment. And as a 5-marker, the histopathological features could be asked. Now, definition of pleomorphic adenoma. It is defined as the most common benign salivary gland tumor. It is called a mixed tumor because it shows both epithelial components and myoepithelial components, characterized by diverse histological appearance. It justifies the term pleomorphic, which means variable morphology. Most commonly affects the parotid gland, followed by minor salivary glands, especially the palate. Now, please do note the following anatomical diagram. It is an important diagram that should be drawn for your 10-mark questions. Now let's move on to the etiology of pleomorphic adenoma. The exact cause is unknown. Theories suggest that they arise from reserve cells of intercalated ducts and myoepithelial cells, and other associated factors that are genetic, such as genetic mutations, for example the PLAG1 gene, that is the pleomorphic adenoma gene 1 rearrangement, and radiation exposure, and it is not related to infection or lifestyle directly. Moving on to the clinical features. The clinical features suggest that the most commonly occurring age in a human being is the 3rd and the 5th decade of a person's life. There is a slight female predilection, which means that the rate of occurrence in females is slightly higher than that of males. The common site is the parotid, whereas the palate is the most common minor gland site. The swelling appears as slow-growing, painless, firm in consistency, and is usually unilateral, which means that it occurs on only either one of the sides of the palate. Some more clinical features include that the surface of the parotid gland appears smooth and lobulated. The mobility, mobile in early stages, whereas it may become fixed later. The skin or mucosa appears normal with no ulceration unless any physical or chemical trauma. Facial nerve involvement is absent. Long-standing lesions may show large size, risk of malignant transformation such as carcinoma ex pleomorphic adenoma. Now moving on to one of the most important topics under pleomorphic adenoma, which is its histology. Histology represents a well-circumscribed, often encapsulated tumor, whereas the capsule can also be incomplete, composed of epithelial cells forming ducts and sheaths, myoepithelial cells that could be spindle, plasmacytoid or clear cells. Duct-like structures, inner epithelial cells, outer myoepithelial cells. Some more histological points. The stroma is highly variable, which is its key feature, composed of myxoid component, chondroid component and fibrous. Mixed appearance gives tumor its name, may show hyalinization and calcification. Capsule may show tumor extensions called pseudopodia, which is important for reoccurrence. The prognosis for pleomorphic adenoma is excellent. It is slow growing and benign. Recurrence possible if incomplete excision, a capsule rupture during surgery. There is risk of malignant transformation in long-standing untreated cases and may lead to carcinoma ex pleomorphic adenoma. Overall survival is very good with proper treatment. Now moving on to the treatment. Surgical excision is the most common treatment of choice. Types are the superficial parotidectomy for parotid tumors and wide local excision for the minor glands. Important points are avoid simple enucleation, which could lead to recurrence, and preserve facial nerve in the parotid surgery. There is no role for chemotherapy in benign cases. The following is the point-wise summary of the pleomorphic adenoma. Please do know that it is the most common benign salivary gland tumor. It's a mixed tumor consisting of both the epithelial and myoepithelial cells. It is the most common in parotid gland, following the palate. Slow growing, painless swelling. no facial nerve involvement, and histology shows ductal plus myxoid or chondrite stroma. Treatment includes the surgical excision and good prognosis but risk of reoccurrence and malignancy. If you do have any questions or doubts, please do comment in the comment section down below.